Medicare has 4 parts, A, B, C, and D. If you don't understand the difference, you could end up with out-of-pocket costs that you thought were covered, or even permanent penalties. I'm breaking down all 4 in plain English so you know exactly what you're getting into before you turn 65. Why this matters? Most people turning 65 assume Medicare covers everything, but it doesn't. Part B only covers 80% of outpatient care, and that other 20% has no cap. That means unlimited financial exposure. Miss your enrollment window and you'll pay penalties for the rest of your life. I'm Aaron with Martin & Lark Insurance. We are committed to helping families in Northwest Ohio and Southeast Michigan navigate Medicare. By the end of this video, you'll know what each part covers, what it costs, and how to avoid the mistakes that catch thousands of people every year. Part A, hospital coverage. Part A covers inpatient hospital stays, skilled nursing, hospice, and some home health care. Most people don't pay monthly premium because they paid into Medicare through payroll taxes. But no premium doesn't mean no cost, so you still pay a deductible per benefit period. $1,736 is that deductible in 2026 for Part A. Get admitted twice in 1 year, you could pay it twice. Part B, the 20% trap. Part B covers outpatient care. Doctor visits, lab work, procedures, equipment. The standard premium is $202.90 per month in 2026. And there's a $283 deductible for the year. Medicare pays 80%. You pay the other 20% with no annual cap. If your medical costs hit $100,000 in a year, you owe $20,000. If they hit $200,000, you owe $40,000. There's no ceiling. This is why so many people add a Medicare supplement to Original Medicare or choose to replace Original Medicare with an Advantage plan. Part C, this is Medicare Advantage. So Part C, or Medicare Advantage, is an all-in-one alternative offered by private insurers like Medical Mutual, United Healthcare, Humana, and Aetna, and there are more. When you enroll, you're no longer using Original Medicare. The private plan becomes your insurance. These plans typically bundle hospital, medical, and drug coverage, and they usually include extras like dental, vision, and gym memberships. Here's the trade-off. You have networks, co-pays, and restrictions on which doctors you can see. But unlike Original Medicare's unlimited 20% exposure, Advantage plans cap your annual out-of-pocket costs. In-network max is $9,250 in 2026, and the combined in- and out-of-network max for 2026 is $13,900. However, these caps are typically set much lower by the private insurance companies. Part D, the permanent penalty. Part D covers prescription drugs. If you skip it during your initial enrollment period, the 7-month window around your 65th birthday, and you don't have other creditable drug coverage, like through an employer, you'll pay a late enrollment penalty, and that penalty is 1% of the national base beneficiary premium for every month you delayed. This gets added to your premium for as long as you have Medicare, which for most people is the rest of your life. Even if you don't take prescriptions currently, enroll or make sure you have creditable coverage elsewhere to avoid this penalty. Here's how the parts fit together. Most people choose one of 3 setups: Original Medicare plus a supplement plus a Part D prescription drug plan. This gives you maximum flexibility. You can see any doctor who accepts Medicare, and the costs are predictable. There are higher monthly premiums going this route. Medicare Advantage with drug coverage would be option 2. It's often low or $0 premiums. There are extras included, and there's an out-of-pocket cap. However, network restrictions apply. 3 would be Original Medicare plus a prescription drug plan and no supplement. This would be the lowest premiums, but you're exposed to that uncapped 20%. One serious health event could be a financial disaster for a lot of folks. There's no one-size-fits-all answer. It depends on your doctors, medications, budget, and risk tolerance. If you're in Northwest Ohio or Southeast Michigan and turning 65 soon, or you're already on Medicare and unsure if you made the right call me directly. My number's in the description. And watch my next video, Medicare Advantage versus Medigap, which one actually protects you. We'll get into the nitty-gritty on both sides.